Pancreatic cancer behaves unlike almost any other disease. Medical professionals often compare it to an asteroid strike. It doesn't slowly build up over decades of obvious bad habits. It drops out of the sky and hits the body completely without warning. The reason it hits so quietly comes down to anatomy. The pancreas is buried deep in the back of your abdomen, tucked securely behind the stomach. Worse, the protective membrane wrapping it, the peritoneum, lacks the fast-acting nerve endings that normally trigger sharp pain signals. Because of this numb zone, a tumor can expand for months in total silence. You only feel it when the mass grows large enough to physically crush outward against the spine or stretch the outer abdominal wall. Relying on physical pain to tell you something is wrong is a fatal trap. By the time your back starts hurting, the mass is already massive. Because it hides so effectively, standard annual physicals and routine blood work frequently miss the tumor entirely. But this disease does actually leave a trail. It just doesn't speak in the obvious language of pain. It communicates through bizarre, highly specific mechanical glitches in your body. Patients consistently report the exact same strange symptoms months before a diagnosis: a sudden spike in blood sugar, rapid weight loss without exercising, highly foul-smelling gas, and a physical revulsion to meat. Individually, these sound incredibly minor. A general practitioner might give you some antacids, suggest a diet change for the blood sugar, or write it off as a passing stomach bug. Catching the tumor requires looking past the individual symptoms. We have to view these glitches as a biological chain reaction, all triggered by a single failing organ. Think of the pancreas as a machine with two engines. The tail is your hormone control center. When a tumor grows, it pinches the internal ducts, creating intense pressure that backs up into the tail, collapsing sensitive cells and completely shutting down insulin production. Without insulin flowing into the bloodstream, the body loses its ability to process glucose. If a healthy adult with no prior medical history suddenly develops uncontrollable diabetes, it is a massive red flag. That sudden sugar spike is the first domino falling from the hidden pressure of a tumor. The second engine is the head of the pancreas. This is the master plumbing system for your digestion. When that same tumor blocks the ducts in the head section, it traps over 30 vital digestive enzymes, preventing them from ever reaching your stomach and intestines. Without those specific enzymes to break down food, proteins and fats pass through your gut completely unprocessed. Instead of being absorbed, they literally sit in your intestines and rot. This rotting process is exactly what causes the bizarre physical symptoms. Starving cells cause rapid weight loss, rotting proteins generate foul gas, and a sudden aversion to meat. Your brain knows it just can't digest it. Once a doctor connects these dots, standard blood work isn't enough. They have to deploy heavy-duty tools, running specific tumor marker tests like CA19-9, and using specialized MRIs to look deep into the back of the abdomen. To get the clearest picture, gastroenterologists using endoscopic ultrasound. By passing a probe directly into the stomach, they can scan right through the stomach wall and look point blank at the pancreas. By taking those strange digestive and blood sugar symptoms seriously and tracking the dominoes backward, modern medicine can intercept the mechanical failure before it reaches a terminal stage. Decades ago, a diagnosis like this was an automatic, inescapable death sentence. We have to strip away that outdated myth. The historical hurdle was surgical. These tumors don't just sit politely on the organ. They trigger massive inflammation, turning the tissue into something resembling solid concrete poured directly over the major arteries supplying your intestines. Removing it meant destroying the blood vessels. The solution didn't come from a sharper scalpel, but a chemical strategy known as downstaging. Before even touching a surgical blade, doctors hit the area with targeted chemotherapy and radiation. This precise chemical attack physically shrinks the mass. It forces the tumor to recede and peel away from critical blood vessels, creating a clean margin for extraction. By reframing the cancer as a structural engineering problem, shrinking the obstacle before extracting it, tumors that were once considered completely inoperable are now routinely removed. The final layer of this modern defense is precision medicine. Doctors can sequence the exact genetic fingerprint of the tumor and deploy immunotherapies built specifically to target those mutated cells. This integrated approach is yielding results that were statistically impossible just 20 years ago. At specialized research hospitals, stage 4 patients who successfully respond to downstaging and qualify for surgery are achieving 5-year survival rates as high as 16%. But the most effective tool in the arsenal is prevention. Because the disease is heavily triggered by internal inflammation, research at National Cheng Kung University suggests that the simple combination of daily exercise and eating 5 servings of fruits and vegetables can reduce the risk of a tumor forming by 50%. Pancreatic cancer is a brutal disease, but it has a mechanical weak point. By listening to the strange early whispers of our own biology and trusting the exact mechanics of modern medical engineering, we finally have the power to challenge the king of cancers.